1.3.
1.3. Okay, yeah. And just repeat what you said.
Yeah. Well, we, as far as this organization goes, this hospital, it's an acute care facility. We've got our normal inpatient, I believe, is 150 inpatient beds. We see inpatient and outpatients, do outpatient surgery. And our organization, it's a healthcare organization, so we, take care of trauma patients 4 nights a week. We have trauma call here where they bring patients in that are injured throughout the area. And we also have inpatient and outpatient surgery. As far as reporting goes, we report to Joint Commission and the Health Department. We have to report any of our data to them, and then they inspect us every 3 years. And this reporting, the impact that it has on us is that if there's anything that they're concerned about, they'll come back, and there's standards that we have to meet. And so we have to, they do their inspections and make sure that we're meeting their standards, Joint Commission standards. And the Health Department also has standards for cleanliness and food preparation and the way that patients are treated. So we have to, report to both those organizations. And the impact that can have on the organization is if we don't lose our license to conduct medicine here, then, that would be a serious problem. But that's why we have all these organizations that oversee the operations. And that's basically it. That's how we, stay in business.
Okay.
Pretty much.
Yeah. All right.
Yeah. I know I can't be too specific, but that's...
Okay. This is 1.3. And can you please state your name, please?
You're going to take me too? I thought you said you were just going to...
No, I'm going to record you. It's an interview.
I thought you were going to tape record me. All right. My name is Kathy Walter. I'm the Interim Director for Quality Management here at Creighton University Medical Center.
Okay. Excellent. And I will be interviewing her over 1.3 organization analysis. The first question that I have for you is, can you please provide a brief introduction of your organization, please?
Well, we are a acute care hospital. We provide trauma care and tertiary care. So we have a wide range of services. We also have ambulatory care here. We see patients from all age groups, all socioeconomic backgrounds. We see people from the rural area as well as the urban area. We attract a 200-mile radius, and so we are a very busy, integrated facility.
Okay. Next question. How do you characterize your organization based on a model of standard and or custom care?
Well, the standard of care, there are several entities that we use for standards of care. Each of the organizations, like the American College of Surgeons and the infectious disease and internal medicine, they all have their organizations, as well as we also have the Institutes of National Health. We have different bodies throughout that are looking at evidence-based care. And what evidence-based care is looking at things that we do at the bedside that make the outcomes good. And if the evidence has been found that if you repeat these over and over and over again, then your outcome should always be good. And so those develop into standards of care. So we institute those within our hospital, and we have order sets, we do education, and we monitor the effectiveness and our outcomes to those evidence-based care guidelines. Now, your other question was what? Evidence-based care and standards of care? Is that what it is?
Yes.
Standards of care?
Standards.
So, standards of care, again, a lot of it has to do with organizations and practicing bodies. The Nursing Association has standards of patient care that we follow. Maternal child medicine has standards of care, and those are all embedded into our care plans and our policies and our procedures and our educational processes.
Okay. The next question is, how is public reporting conducted for your organization?
Public reporting is based on a couple different avenues. One is there's vendors that gather our data, and so we report our data to the government, to these vendors, and then they will look at our data compared to other people, and then they put out the reports. So some of our data we have to go into the chart and abstract the chart, look to see if the data is there, and then we put it into the vendor software. They collate it all, and then they submit it to the entities that need it. So Joint Commission, our payers, the government, and then those people will put out the official reports, the comparison reports. Usually, even though our data is submitted pretty timely, real time, within a month or so of the patient going home, it's not publicly reported for several months because they are getting the data from all over the nation, correlating it, compiling it, and then they put it out. So when you look at hospitalcompare.gov, it is data that's a year old. So that's kind of hard sometimes when you know you've made improvements and you don't see those on that website as timely as you would like to see those.
Okay, and the last question is, what is the impact of public reporting on your organization from both an operations and performance position?
Public reporting has been very good. I think it has made everyone, especially the public, be able to go to those websites and see what the comparison is, and that helps them choose where they want to have their health care. It also there's a competitive nature, and I don't want to say forces us, but it challenges us to improve our processes and to be better with trying to raise the bar and meet all those achievements. It attracts new business. When you have good outcomes, people want to work there, so it helps us with our recruitment strategy, not only with our nurses and physical therapists and pharmacists and all the people at the bedside, but also our physicians. They want to come and work at hospitals that have those good outcomes. So you can kind of use it for advertising in one respect. You want patients to come to your hospital where they're going to get good care and they can see that we're achieving those metrics and those publicly reported outcomes. And then you also have the business side of it where it helps you attract new business. On the inside, it challenges you and keeps us on our toes because we don't want to lose any ground. We want to continue to improve. And so we spend a lot of time with education, looking at our processes, hardwiring our processes so we can make sure that we achieve all those outcomes.
Excellent. And that is all the questions I have for you for 1.3.